In honor of Colorectal Cancer Awareness Month, CGA has curated a toolkit of educational as well as clinical practice resources on the topic of early age onset colorectal cancer.
We all know that the incidence of colorectal cancer before the age of 50 is increasing, and patients are managed on guidelines that are not specific for this age group. An international group of experts with different backgrounds and proposed the first evidence-based guideline on early onset colorectal cancer. The DIRECT group, DIRECT stands for Delphi Initiative for Early Onset Colorectal Cancer, produced 31 statements in 7 areas of interest: diagnosis, risk factors, genetics, pathology, oncology, endoscopy, therapy, and supportive care. The DIRECT group is composed by the highest level of expertise in this disease. 3 scientific societies supported and endorsed our recommendation: the Collaborative Group of Americans on Inherited Gastrointestinal Cancer, the European Hereditary Tumor Group, the International Society for Gastrointestinal Hereditary Tumors, and the Associazione Italiana Familiarità Ereditarietà Tumori.
Practical guidance for clinicians on knowing which patients to be worried about, how quickly they should be evaluated, and by which modality. Once they're diagnosed with cancers, which ones should be undergoing genetic evaluation and what should that genetic evaluation entail? And then, of course, the issues around family planning and fertility will be an immediately useful tool for clinicians around the globe that are facing this rising tide of early onset colon cancer. Many questions left unanswered, but looking forward to seeing more and more data come out on more refined risk assessments, such as blood-based biomarkers, stool-based biomarkers, all the way through issues around surveillance after colon cancer diagnosis in young patients, personalized treatments, and the really important question of chemo prevention. One of the most important things, and that is bringing it back to the patient and understanding from the patient's perspective and their exposures over a lifetime, diet, lifestyle, medications, how those things may impact risk to inform future risk reduction strategies. Very exciting work. We look forward to hearing how it evolves over the coming years.
Scientific knowledge in early onset colorectal cancer is in constant improvement and change. Therefore, our guidelines really need to be updated to maintain validity. Updating is crucial for maintaining the validity of recommendations and to reduce the variability into clinical practice. We also need, I think, to have on board more non-Europe, non-US experts to integrate different geographical issues and different healthcare systems. Early onset colorectal cancer rising incidence is a critical, common call to action for which we, the DIRECT group, have the mission to convey unequivocal information and clinical guidelines.
I direct all of you to visit CGA-IGC.com, where you can peruse our toolkit of resources, including this incredibly impactful and clinically useful DIRECT guideline.